We've all heard about GERD or reflux or heartburn. They are all the same things. And what it means is that stomach acid or stomach bile, one or the other, is coming up from your stomach into your esophagus, into your chest, and sometimes even further. It can come into your mouth. It can go back into your lungs. It can cause problems with your teeth. That's what GERD does. And it's probably one of the most common symptoms today. So that's GERD. And it's something that needs to be treated because acid doesn't belong in the esophagus. So we have a lot of treatments for GERD these days, and I want to tell you today about probably the most exciting treatment that we have seen, and that is this little device called LINX. LINX is a device that is like a little bit of a puka shell necklace, all these little magnets together, and what happens is this is put just on top of the stomach where we have a little sphincter, so that when you swallow, this opens up, lets food through. When you don't, it closes up around the esophagus so you don't get reflux back up the esophagus. That's why this works. It's a pretty exciting development. Prior to that, we had a lot of surgeries we did for GERD. You probably heard of the Nissen fundoplication or the toupee or the Belzy. There were a bunch of surgeries that we did, and we still do them in some cases. But this was probably the most exciting one. But because those surgeries were so tough and hard on people, many people instead resorted to pills. You've heard of them, the purple pill, Nexium, omeprazole, pantoprazole, other pills. They don't work. They work in terms of suppressing acid, but they don't work in terms of getting rid of reflux. Here's why acid suppression is good. You don't have acid in your esophagus, it doesn't burn. Does that stop the material in your stomach from refluxing up? It doesn't. Does it stop the material from going in your lungs and causing aspiration pneumonia? It doesn't. Does it stop from going up into your mouth and causing enamel decay in your teeth? It doesn't. Does it stop from going into your voice and having a hoarse voice? It doesn't. Acid suppression simply suppresses the acid in your stomach, and it's been associated with some problems. If you have acid in your stomach when you eat and you have some bad bugs on your romaine lettuce, that will keep those bugs from multiplying because they don't like the acid environment. You suppress acid because you're on this, because you're worried about it. What happens? More food poisoning. It's also been linked with kidney stones, dementia, fractures. You don't want to be on prolonged acid suppression. You have to think about surgery for it. The most dangerous complication of acid going into the esophagus is something called esophageal cancer. We don't have very good treatments for esophageal cancer. So that's why you want to not have acid or other materials going up there. And by the way, the pills, you can put people on the pills in a regimen, and they've done these studies. They don't decrease the risk of esophageal cancer because you still have reflux. So we're pretty excited about this little device that we can put around your esophagus. It comes apart. That's how we put it around. And we do this all laparoscopically through those little tiny, like operating with chopsticks. But this is what we're excited about today in terms of heartburn and heartburn surgery.